First of all, a big thank you to MASH and the Global Health Network for organizing these various workshops and for inviting me today to talk about collaboration at an international institutional level. My name is Gabrielle Breugelmans, and as Robin already indicated, I am heading the Epi department at CEPI, the Coalition for Epidemic Preparedness Innovations. And as most of you may know, CEPI is an innovative global partnership between the public, the private, philanthropic, and civil society organizations. And we were launched in Davos back in 2017 at the World Economic Forum to develop vaccines to stop future epidemics. So collaboration, which is the theme of today's workshop, is really a part of our DNA, I would say, since our conception. Next slide, please. So our mission is to accelerate the development of vaccines against emerging infectious diseases, and also to enable equitable access to these vaccines for people during outbreaks. We are one of the founding partners of the Access to COVID-19 Tools Accelerator, which is a global coalition to accelerate the development, the production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. So together with Gavi and the WHO, we have launched as part of the Accelerator the COVAX initiative to ensure equitable access to COVID-19 vaccines and to end the acute phase of the pandemic by the end of 2021. So the bottom line is, what we do as CEPI is that we really want to create a world in which epidemics are no longer a threat to humanity. Next slide, please. As part of the workshop today, however, I'm not going to talk about COVID-19 vaccines, but rather I would like to tell you about our experiences with the Lassa fever Epi program that CEPI is currently implementing. Next slide, please. So to start with, I will shortly explain why CEPI is actually investing in Epi studies, as not everyone may be aware of this. So first and foremost, Lassa fever is one of the 6 priority pathogens that CEPI is targeting. And out of the 6 partnerships with Lassa fever vaccine developers, 2 vaccine candidates actually have now entered into a phase 1 clinical trial. So however, as we currently stand, there are still significant gaps in our understanding of the burden of disease of Lassa fever. And if we do not solve this quickly, this will hamper the evaluation of vaccine efficacy when the developers move forward in these late-stage clinical trials. So furthermore, in addition to measuring a baseline for measuring vaccine efficacy, data from these burden of disease studies will also facilitate the actual design and to form the location of future Lassa vaccine trials. And lastly, these burden of disease studies will build on existing national surveillance and ongoing research in the country, really providing a framework for capacity strengthening for, amongst others, laboratory testing, diagnostics, clinical site readiness, GCP training, to ensure the readiness for future vaccine trials. Next slide, please. So to start this large research program, we actually launched an expression of interest in 2018. And it was really clear from the start for us to involve the research communities from Lassa fever endemic countries. So to the expression of interest, we received 10 submissions, and in the end, we retained 7 groups across 5 countries, including Benin, Guinea, Liberia, Nigeria, and Sierra Leone. So in Liberia and Nigeria, we had more than 1 group applying, and we decided to combine them in order to have only 1 consortium per country. This, however, was a bit more complicated than initially foreseen and expected, and we had to do some, we call it jokingly, marriage counseling to get to get to one consortium that everyone agreed upon in both countries. So following the identification of the various research groups, we then took a collaborative approach to define the study aims and the objectives. Next slide, please. So to have a clear understanding of the local data needs, we decided to have 2 workshops to discuss in a collaborative manner the overall study objectives, the design, key harmonized elements, really in the end to facilitate vaccine development for Lassa fever in West Africa. First workshop was conducted in Accra in Ghana in November 2018, and the other one in Abuja, Nigeria in 2019. And the latter was actually as a side meeting to the Lassa International Conference that was hosted by the Nigerian CDC. So important outcomes from both meetings included one, a synopsis that was going to be used for developing a common core protocol to be used across all study sites. And actually both meetings really provided improved insights in and options to establish collaborative consortia to address certain epi gaps that we were facing. So another important outcome of the meeting was the establishment of the governance structure of the study program. Next slide, please. So as you can see from this slide, the governance structure of the study is actually quite complicated, with oversight and coordinating bodies above the dashed line and the program execution partners below the dashed line. I'm not going to explain this slide in detail with you, but what I would like to mention to you is that one of the issues that was of critical importance to CEPI was actually the involvement of ministries of health or National Institute of Public Health to be part of this study program really from the beginning, not only because of awareness, but also to encourage active involvement in both the EPI studies and also for the future vaccine trials. So to achieve this goal, we established a so-called Council of Public Health Authorities, really with the aim to provide guidance and to share alignment of study activities with endemic country needs. So to support the program execution during the preparation phase, we implemented several task forces, and one included a communications and community engagement task force. Next slide, please. So the objective of this critical task force for us were to develop an expectation and guidance document to inform the development of community engagement plans that were tailored to the study sites, and also to have a communication plan to be used consistently across the different study sites. Furthermore, the task force provided recommendations on communication and community engagement to the so-called field implementation work group, really to inform any protocol revisions there were, really to be aligned with local needs and also local wishes. Next slide, please. So as part of our activities with local community leaders in West Africa through the Lassa fever program, CEPI actually has decided to create its CEPI community engagement network, which is also known as CEPInet. So this is a network of clinical investigators, social scientists, and institutes that are committed to the development of effective, culturally appropriated community engagement models to support vaccine development of CEPI's priority diseases. Community engagement is an integral part of CEPI's enabling sciences strategy in supporting vaccine development of emerging infectious diseases, and it will be key to the future use of CEPI-funded vaccines, particularly low to middle income countries. Furthermore, we strongly believe that collaborating with community stakeholders builds trust and lays the foundation for a meaningful engagement in the future. So the goals of the network are threefold. First, we really would like to strengthen communities and research institutions to expand and deepen existing partnerships, and really also to forge new ones. With the overall goal of facilitating effective community engagement in all aspects of epidemiological studies towards vaccine development against emerging infectious diseases. Second, CEPI will provide a platform that enables shared learning and knowledge to build trust and understanding among the community stakeholders. And lastly, it will support and lead to development of new research opportunities that could be supported by external partners outside the scope of CEPI projects, such as the MESH network. And at this time, I would like to end my presentation, and I would like to thank you for your attention.